Hi, I'm Dr. Shama here. I'm here with my colleague, Dr. Isabella Bergagnini, from our obesity and endobariatric clinic on 85th Street. So, Dr. Bergagnini, I've heard you mention that obesity is a multifactorial disease, and obviously, when patients come to us, I try to use kind of a diffusing start to make sure they know that we know that their obesity journey is not just their fault. It's not simply they eat more, therefore they're obese, but maybe you can walk us through how you approach and how you make our patients feel comfortable in our clinic when they come to see us.
Yeah, absolutely. So for any patient that comes into my clinic, I first make it known and clear to them that we know that obesity is not just a condition of overindulgence, but rather a chronic, complex disease with a number of different causes for it. And I kind of alluded to it earlier. We know that there are a number of genes that can certainly influence things like how a person stores body fat, metabolizes nutrients, and it also is responsible even for signaling feelings of fullness. Appetite regulation in general is unique. It's a complex process and it's controlled by a number of regulatory systems within our brain, which is at the forefront in terms of controlling this. Other things that can contribute to weight gain include sleep hygiene, stress, the medications that we take on a day to day basis, which most patients are not even aware of, the types of foods that we consume, so the ultra processed foods that are in our day to day diets, energy expenditure, so, how much patients are actually moving on a day to day basis. Um, as well as even our own body composition influences our own basal metabolic rate. So these are all things that can greatly impact our predisposition to obesity. So all in all, we don't want our patients to feel like this is their fault, and there are simply some things that are out of their control. Instead, we want to our patients to have this sort of better understanding of what's contributing to their obesity, and we want them to take this sort of deeper dive with us into understanding this and what's predisposing them. So that they can actually ultimately feel more empowered and more in control of managing their weight.
Yeah, I couldn't agree more. I believe, I want our patients to feel that they have a partner in this process, in this path, and we're not just loading up their plates, quote unquote. That we know that the deck is stacked against our patients who are trying to lose weight. It's not, as you said, strictly I eat more and therefore I gain weight. But we recommend, being active, and that can mean different things for different people, doing things that may, build muscle mass, which will help them burn more calories, eat diverse, colorful plates of lots of fruits and vegetables that are available. And obviously that in some areas in Manhattan and in New York City and in the tri-state area, that's hard to find these things. And we are predisposed to going for the processed foods because it's cheaper and easier to find, but we need to kind of break that cycle. And we try to really break it down so at least those factors that are in our control can be controlled and can be used to our advantage as opposed to our disadvantage.